and Dave, thank you so much for inviting us and helping us get all set up. We're so appreciate it. And to start off our presentation today, I do just want to point to our table. We have a lot of free calendars if you would like some. In the calendars are our hospice pets, who, by the way, the greatest day at work is when you have a bunch of dogs coming in for a photo shoot. Amazing. So every month is a different therapy dog. So please, if you feel so inclined, take them as you go. And to start off our presentation today, we're just going to show you a quick video that our lovely Maureen created. Maureen is our Marketing and Communications and Veterans Outreach Manager. Maggie is our wonderful Community Engagement and Philanthropy Coordinator. And my name is Morgan. I'm the Philanthropy Manager at Partners in Care. All right. Just kidding.
Choosing Partners in Care for your loved ones means entrusting them to an organization full of people who prioritize compassion and dignity and just a high level of excellence for those that they're caring about.
We come right alongside a patient wherever they are in the process, and we have them at the center of everything we do and the decisions we make.
They're the most caring and competent people that I've ever seen working with people. And I've seen them working, and the family appreciates it, the patient appreciates it, they love to see them coming, and it's just very special.
I couldn't have asked for anything better than to be involved with these people that work here.
I can personally speak about the care that they've provided. I had my own father on our hospice services, and when the team came in and cared for him, it wasn't just him, it was my mother and the rest of our family as well.
Hospice and palliative care is different than any other form of medicine. We work as a team because we treat people as a whole. It's not just our bodies or our disease or whatever organ's not working. It's our bodies and our mind and our spirit. And that's the focus of what we do at Partners in Care, is to treat patients and their families and treat them as a whole person.
The earlier you can get it on it, the better. Hospice, they provide so much more than just medical care. They provide for your family. They help you emotionally. They, obviously the physical, they help with that. But if you come on too late, you miss all of that. And I think people are scared of hospice because we don't talk about death in America.
When the determination hospice was made, and we got a nurse and a social worker, and they started settling me into the caretaking stuff and the planning and so forth, and the nurse taught me everything, and it became a very rewarding kind of thing. At first it was, oh my gosh, I can't do that, but when I look back on that, it's the best thing I ever did, I think.
Partners in Care is a family. We operate as a family, and we provide a care as a family. Even people who doesn't have family to take care of them, there's someone who will leave them by their side at the end of life.
The organization is extremely pure. It's pure in its motivation and its mission, and that is from every staff member all the way to the board.
All the nurses, all the staff, all the doctors at Partners in Care bring that special compassion, that desire to serve, right? It must be their connection just like it is for me. And so that shows up every day.
We did something for him. This is hard. He hadn't seen his mother in years and years. And our chaplaincy paid for her to fly out here from Arkansas. And she walked to the door and she said, "That is my baby." And so that was good. That was a good memory.
We start working with individuals and families as early as possible to make this transition an important time. It's a very important time, and it should be something that family members can reflect on as positive. And that sounds a little strange, because who could say that that was a positive time? But it's those last times you have with those family members.
Hospice was not a thing to even think about. It was just as death, you know. Oh, sure, we're all going to die. What was it Woody Allen said? I know I'm going to die, I just don't want to be there when it happens, you know, that thing. Didn't talk about it.
Our culture needs to understand death and accept death better. We need to be able to take care of our elders and embrace aging, embrace these things that we go through as human, the human story.
We think about hope as like something out in the future, and I think what happens when people, specifically on hospice, is that the hope redefines itself. One of the things that hope means for somebody who might be nearing end of life is the fact that no matter how many days they have left, they're able to actually have quality of life during those days, and that just allows hope to emerge in a new way.
Hope is not looking out there, it's looking at the here and now and how we can help individuals who are facing death and their families and people that surround them redefine what hope might mean.
There's always things we hope for. We may hope for more time or for less symptoms or to be at a certain event or to see a new grandchild or whatever ceremony or live for another birthday.
I think I have more hope than I did. It was overwhelming to think of everything that I want to accomplish. But, you know, things like Partners in Care, putting together a team to help me get my clothes done. That's huge, because that was really important to me. So it gives me hope that it's actually going to happen.
The way that they cared for my father with such compassion is something I will never forget.
I'm ready to go when God takes me. So I'm at ease, and I just want to enjoy the people I love, and I'm good with it.
Well, thank you for watching that. That was a serious work of love over last year. Partners in Care celebrated its 45th anniversary of hospice last year. We do much more than hospice, but hospice was the 45th anniversary of serving Central Oregon in 2024. And so we did a lot of work of celebrating that and recognizing the 45 years that we have been serving all of Central Oregon with hospice care. I'm sure you've seen our building in Redmond. How many of you have driven past Partners in Care in Redmond? It's kind of hard to miss. But we do serve more than just Redmond. So we cover over 10,000 square miles from Madras through Prineville, all the way down to Lapine, out toward Black Butte Ranch, out actually to Christmas Valley, Fort Rock, Silver Lake, and Upper Klamath County. So we cover a very large area in Central Oregon with hospice and all of our other services as well, which we will talk about. We thought it would be interesting to share this information for Redmond, since you guys are here in Redmond. I am a resident of Redmond. We have 1,031 patients across our service lines of transitions, home health, palliative care, and hospice. 164 of those right now are in Redmond, which makes up about 16% of the people that we are caring for. Deschutes County has the predominance of our patients that we do care for.
But we do see quite a few in those outlying areas, as there are some. We are one of the only organizations that does serve some of those outlying areas out toward Christmas Valley and Fort Rock and Silver Lake as well. We are supported by over 200 staff members. That's our full-time staff as well as part-time staff. And then we have about 200 volunteers now. So we have about the same number of volunteers serving all of Central Oregon that we do our full-time staff, which is pretty incredible. And the volunteers, they not only visit with patients, but they help with administrative work. I have some that do veterans outreach specifically with patients. We have some that do medication delivery from the pharmacy that we have. They drive around and drop off medication to ensure it gets to the patients in a timely manner. We have hospice house volunteers as well that greet people. There's a myriad of volunteer opportunities, as well as our therapy dogs that we have. I think we have over 20 therapy dogs that go out and visit patients and go to facilities throughout Central Oregon as well. So this is just a quick snippet of where we actually serve patients and their families, and we don't show on here Upper Klamath as well as Lake counties, but you can see that Bend is our primary office. We do have an office location here in Redmond and one in La Pine. Those ones we don't typically have people in to see them. That's where our nurses will sit and they will chart and our team will do work and we'll have some meetings. We have hosted Redmond Chamber events at our Redmond office as well. And then we also have Madras and Prineville. We have physical locations in those areas as well to support those patients and their families. So Partners in Care, what I like to say is that we offer the full spectrum of care for all stages and all ages. What that means is, I'm sure that any of you can think of, the people that we were saying prayers for today, or that you wanted us to think goodwills for. You can think of a neighbor, a friend, a loved one, someone who may have a serious illness, someone who may have a chronic illness. Our team will step in from the very beginning of that diagnosis of that serious or chronic illness or a life-limiting illness such as ALS, dementia, Parkinson's, and often we will support them with what's called transitions, which is our non-clinical resource-based program where we walk people through how to navigate that serious illness. There's a lot of people that we see in Central Oregon and the Redmond area as well who they may have a serious illness, they may live alone, they probably get Meals on Wheels from the senior center. They may be isolated and just have no one to turn to. Our team will step in with transitions and support them and walk them through, how do I navigate this? Where do I go for help? Do I need housing? Do I need to get into a senior living facility to get more care? Should I get meals? What about transportation? What are my next steps with medical care? Things like that. So that's at the onset of serious illness. Palliative care can also be at the onset of a serious illness. How many of you know what the word palliative means? What it actually means? Jane, you're left out. You can't answer this question. Who knows what palliative means? Okay.
I can read it.
Oh.
It's a care given to improve the quality of life and help reduce pain in people who have serious or life-threatening disease, such as cancer.
All right, I'm done. I'm out. Good job. Yes, so palliative, the word palliative actually means comfort. A lot of people associate palliative with hospice care, but palliative care is something that really should come at the onset or diagnosis of a serious illness. Our palliative care team is Dr. Jennifer Bleckman, who you saw in the video, and then they also have a team that works alongside Summit in Bend, as well as they do home-based visits and clinical visits as well with Summit, but they work with people who have that serious illness to improve their quality of life, help them with their medical choices, help them navigate that care, and, give them that comfort that they need so they can do the things that they would like to do. So you think of that person who's on transitions, they can also be seen by a palliative care team to help them navigate all of that. And then there's home health. Home health is a kind of a different animal. That's if someone gets a surgery or someone falls and they have a surgery and they need physical therapy at home, our team can come in to support that skilled need. If they are homebound, the nurses can come in. We can have wound care. The therapist can come in, physical therapists, occupational therapists, speech therapists, and they can help them at home to regain their independence. And that is something that we offer, again, all throughout Central Oregon as well. And then there's hospice. So you think about the trajectory of an illness And if someone is, seeking curative treatments and they're getting palliative care and they're working to improve their quality of life, if one day those treatments don't work anymore, or they decide that they do not want to seek that curative treatment and go through chemotherapy or whatever it may be, that's when hospice steps in. And I think, much like the video said, a lot of people access hospice too late. The earlier people can get out hospice, the better, because the entire team comes in to support them. So that's why we call it our continuum of care, because we really follow patients. We can follow one patient from the day that they're diagnosed with a serious illness through end of life and beyond, because then we can support their family members with our grief support services as well.
All right, and when we learned that we were going to come speak at Kiwanis, we really wanted to show how we support youth and families, because we recognize how much impact you all have in that area. So we wanted to share that we're one of the only organizations that serve pediatric hospice and palliative care patients. Today we have 2 pediatric hospice patients. One of them was onboarded today. So we try to work with the whole family. Typically that's a lot of family members that are with a pediatric patient, and like Maureen was sharing, we wrap them up in care. We also have Camp Courage, so that's in partnership with Clear Morning, and that is a grief camp for kids and teens. So they do that once a year for about a week, but they also meet quarterly to come together and support one another throughout the year. And it's a really special event. We were able to help provide fruit for their fruit smash, and it's so fun. You just watch these kids smashing fruit with bats. It's so cool. And then I had the honor and privilege of meeting a gentleman last year when I first moved to Central Oregon. He was one of the first people I met on the job, Jerry Kalana, who donated to start a loss of a child support group at Partners in Care, which was just one of the most incredible and impactful things that I've ever been able to be a part of. And so we were able to put on a full-day workshop for these parents who had suffered that loss. And our 2 grief counselors, Carla and Carla, still work with them today. They're in a support group currently where they're still walking alongside them. So that's a little bit about our service that we give to youth and families. And then, like Maureen mentioned about our continuum of care, this is really a graphic where we try to show everything that we do for a patient and a loved one. So, we have the PCP, Hospice MD, RN, and then we have our chaplain, who is a spiritual counselor. No matter what your belief is, we have someone who can walk alongside you. A medical social worker, home care aide, trained volunteer, PTOT, and grief counselor. And those grief counselors follow those patient families for a whole year after a loss. So what we really try to do is help patient families remember that they're not caregivers, they're not social workers, they're not a doctor or a nurse, they're family. And they have the right to be that. We take that off of their shoulders so that they can just be with their loved one. So this is our hospice house. In 2022, we built this house thanks to the generous support of our community. We are the only hospice house east of the Cascades, and we partner with several community organizations to have people come to our inpatient care. This is a specialty hospital, so the 2 main things that we do within this hospital are respite as well as general inpatient care. So what respite can offer for families when they are caregivers is that if you have a special event you've been looking forward to, if you just need some time, because taking care of a loved one is a full-time job, we can have a patient come and stay at our hospice house. General inpatient is typically when the symptoms that people are trying to manage at home are no longer working. This person may be in pain, restless, agitated, upset, confused, and so we do transport them to our facility where we have 24/7 staff that are able to help and to do IVs and to help get that person feeling better. And we also accept, people come from hospital, people come from all over Central Oregon. Like Maureen shared, we have a 10,000 square mile radius that we're serving in this area.
And since this is the only one east of the Cascades, we have had patients come out from bigger city. I mean, we've had people from all over Eastern Oregon come because they need the care and they're not able to receive it where they live.
And some really special things have happened in our hospice house. We had a wedding right here in this dining room. We threw a Spider-Man birthday party for one of our pediatric hospice patients and their families to celebrate a last amazing birthday. Through these doors in that courtyard, we had an Ochiko Mustang come out and meet a patient and nuzzle her face the day before she passed away. There are amazing moments that happen in this hospice house that our caregivers and our nurses help make happen.
And like Morgan was saying with some of those stories, you know, we could go on and on. I in particular could go on and on, especially about, you know, stories that I've had with veterans that we care for. But we don't have all day. But going above and beyond and, you know, focusing on the patient and their family is really what we are all about. We take it very seriously. And our team is focused on what is the best that we can do for the patients and the families that we are serving. And we have been recognized by Center for Medicare and Medicaid Services, both for hospice and home health. And the hospice one is rated by families. So families are actually the ones that, through surveys, through Medicare, have said that our care has received a 5-star, which is the highest rating you can get on a national scale, and then same with home health. That's actually from the patient's perspective. And we are one of the only, there's 3 5-star We Honor Veterans hospices in Oregon, and we are one of those 3 in all of Oregon. And that, to me, I take that very personally, having served in the military, to offer that dignity and the honor that our veterans, like Dick, deserve at end of life, and to bring them peace at end of life as well. And then we also received the Best of Bend award last year for the hospice category. But you know, these are just you know, stickers that we can put on things. But to us, it's personal. We all have stories that we can share from our own loved ones to people that we've supported. But every day, our 200 staff members and our 200 volunteers, they go above and beyond to really put their patients and treat them like they are their own family, and give them the care that they deserve, as well as, you know, not only the care holistically, but that excellent medical care, and really just to ensure that no matter what's going on in their life, that we treat them with compassion and dignity.
How do you handle someone who might say to you, I'm interested in assisted suicide?
We actually have supported patients with that. So our physicians, if someone is actually interested in, we call it medical aid in dying, MAID. We have assisted patients. I had a 100-year-old female veteran actually who wanted to do that, and our physicians talked them through it and ensured that they were in the right state of mind and that they had the cognition to actually make that decision personally for themselves on the day that they wanted to do it. I know that our doctors do not let people do it if they do not have the ability to make that decision for themselves. And so there's a big process that it goes through if we do have a hospice patient who does want to do the medical aid in dying, but we will facilitate that for patients if they are interested.
Yes, we do counsel people who want to go seek MAID, and our physicians also help people who are interested in VSED, which is voluntary stopping eating and drinking as well. So they just provide information and coaching and evaluate them through that process.
Yes.
Just one question. I know, Michelle, you're wanting to close it because we're after 1, but pediatric care, those children that go in, that's what Kiwanis is all about.
Yes.
Is there something, a package we could put together that maybe they give?
That would be incredible.
So what kind of things would that be?
Oh, that's such a good question. You know, I would love to get your information because we have a wonderful nurse who is completely committed to serving the pediatric patients of Partners in Care, and I know that she would have a lot of ideas for that.
I'll give you my card.
Yeah,
and I'll share it with all
That'd
of
be
us.
wonderful.
Thank you.
Well, guys, we are after 1 o'clock. If you have time to stay for questions, though, please do. I have a gift for you for your time today. This is a pen from, this is from Brian Hobbs, a local artisan that puts those together for Kiwanis, and we'll take a quick picture for you.
Thank you. Thank you for having us.
Please take the calendar for your questions. Our cards are here too if you have any questions after the fact. Thank you guys so much for having us.
You guys might have to fire me.